it's Dr. Jenny at Spinal Corrective Center in Amherst, New Hampshire, and I thought I'd show you a little bit about how we adjust the mid-back, or what we call the thoracic spine. So, people will come to us for all different reasons, and we really value structural work, meaning we oftentimes will really analyze the spine to see whether the spine is subluxated or the spine is not moving properly, and where there's potentially some stress on the nervous system. One thing that's almost always the same with most people, especially people who drive a lot, sit a lot, they're at computers, is they'll be pretty locked up in their mid-back. And you'll know because you'll feel tension, you'll feel stress in your shoulders, you just feel like you always want to move, or you're trying to pop your own back. And so one of the favorite things that people experience through the adjustment is when we help release that tension in the whole area of the mid-back. So what happens is, first the patient will lie down and I'll adjust anything I need to adjust in the lower spine. And I'll start just doing some tension relief. So by stretching the spine out, seeing where it's moving, allowing the patient to relax. This will help me start to learn where their body's not moving properly. And I'll start to palpate the spine itself. I'm looking for areas of restriction. Sometimes the patients will tell me if there's an area that's tender. And when I find a spot, there's just a simple force put in that will release the spine. Sometimes I'll tell the patient to breathe. Go ahead and breathe in. And as they breathe out, good, it will allow the spine to release on its own without too much tension. You can't really tighten up if you're breathing out, so that's one way to do it. One more here. Go ahead and breathe in for me, all the way out. Good. Oftentimes the patient will hear some type of popping noise, and what that is it's just the gaseous fluid that's in the joint space. It's shifting around. So like if you open a can of soda and you hear a pop, that's the same type of thing that's happening in the spine. So it's a harmless noise, and sometimes it actually doesn't happen. Sometimes it's more dramatic than others, but it's one thing that can happen. And afterwards the patient really feels nice and loose in here, and they appreciate that they can breathe again. So it gives them more energy. Be well, everybody.